And first of all, I would like to thank you all for giving this opportunity to present this uh, conference paper. And I'm very thankful. My name is Zeba Mahmood, and I belongs to Kaunas Technology University, Lithuania. And I'm studying here. I'm the student of final year. And this is the paper which I'm going to present is impact of blockchain technology in healthcare sector during COVID-19 pandemic. I'm really thankful for a previous sir that he presented such a nice paper on this COVID-19, and it was really informative about the Twitter that how is getting in. And right now, I'm just trying to give another perspective of COVID-19 pandemic using the technology, which how it could be effective on the and can present a very good things regarding the blockchain technology. Right now, I'm just giving a little bit backward, like a background over that how blockchain role in the healthcare sector. Right now, I would like to explain that I'm living in the Baltic country, and over here in Estonia, especially, it's just like I'm trying to give a small overview. They are already implemented the blockchain technology in their healthcare sector, and these guys are using it very nicely in their hospitals. It's already with their different schemes of the patients, and every data is whichever they put like processing in the hospitals is linked with the blockchain, and they're using the smart contracts and different technologies to compare it. And this is really effective, and this is the country which I'm explaining about, the Estonia is using the blockchain technology very effectively. After this COVID-19 happened, moreover the country started thinking about that how they can implement a very effective way, because we get this thing that we are having a very getting very false news, as the professor told us already. So there was very chaos, and the kind of the problem we get with the economy, that everything falls and people were really in chaos. They were very fearful, so the information was not correct. And even in the health sector, they face a lot of problems, they have a really big problem with the supply chain transparency and so many things involved. But how blockchain could be helpful in the health sector, there is some points that I'm going to mention. There's like a supply chain transparency, patient correct electronic health records, smart contracts for the insurance and the supply chain settlements, medical staff credential verification, and IoT security for remote monitoring. In this paper, what we going to describe over here, like the blockchain advancement, which can really like store the data related to the various phases of the stages and the events of the COVID-19 antibodies, for instance, like improvement, creation, certification, portion to endorse a relationship of immunization reasons, and in the clinics, hospital, and the clinic expert who can get the blockchain to distinguish and the follow and check vaccines and information period to overseeing it. So first of all, the point which came here was a tracing context. The overview of the tracing context is basically like the persons who get into the contact. And now these days, this paper was written like a little bit back in the time when the COVID-19 started, and it was going on with the things. But right now in the present thing, I found that there is so many applications that's already working. Even the people develop the Android applications, like how they are tracing the context. And similarly, our government is doing the similar thing. In the starting, nobody having any kind of data more about it, how they're going to tackle this disease, how they're going to tackle the people who are coming from different places. And a lot of countries getting a lot of problems because of this thing, because they don't know how the people they need to contact, who were in the contact with the people who were affected actually. So this is how it started. And now many governments, many countries already embedded this kind of models in their organization values. So they know, like a very simple example I would like to speak about here. When we are trying to board into the airplane, already we have the contacts, everything, and each in every flight they are just getting the data of the people, and if anybody infected, so whole flight get the message, this kind of thing. So how in the blockchain we are going to do this thing, that the blockchain empowered together the people with the which distinguish them from the utilizing agreements of public and private keys. And even here, I presented a small picture of Beep Trace, which blockchain enabled privacy contact tracing for COVID-19. It's already there, that it's showing how it's like doing it, how it's getting the data, how we can use the private and the public key, and how this beep trace framework utilize blockchain to give anonymized and the individual ID, where we're permitting to controllers and the medical cares, and it's also provides a basic contact with the individual. It provides the information about it. And moreover, this how we can get the more things on the using the blockchain. It provides the security and the protection and the trust, which effectiveness is we can incorporate it with the engineering of blockchain, and which is hard to reproduce or regrow. It's the similar thing, in a very simple way. If I give the example for this thing, that these days we are listening about a lot of newses about the people who say we are not having this thing, or we are not the person who travel or something like that. So this is the way we can provide the security about the persons who really travel, who really have the contact tracing with the person, and it cannot be erased from the data. It is not like the old age ledgers that going to be write with the pen and the paper. This is the ledgers which are going to return with the blockchain, with the contracts, with the POW, like proof of work, proof of stake, and this is not erasable. And for example, I also mentioned here that the Taiwan and the South Korea have indicated that the robust arrangement of contact tracking that can control the speed and disease while permitting ordinary life to proceed for the healthy and individual who generally safe and the contaminated. Now, I'm going to a little bit speak about the blockchain advances that empower people to share their own data in safe way with the general well-being organization without undergoing their characters or contributing that the data to unassigned government or corporate information base may help distinguish individual who can help to contact with the patient who tried to positive for COVID-19. The ability to follow people who are positive to COVID-19 to check their stereotype status and empower their capable resuming of economy without causing a flood in cases. And moreover, it will create the immunization or create groups, which especially it might be for this disease, it might be for other diseases, but it's a very good framework which we can use even in future for for this type of diseases if occur. And we can also choose this. So similar in the figure 2, which I show you already, the beep trace framework, it's providing the functionality of the contact tracing technique using using how we can go from the COVID-19 effectively, and how we can manage, and how we can go with that. The next point over here is convenience of remote healthcare and medical supplies. The basic problem is a very likely the people faces who are not able to get the place how they can get the remote healthcare, and the utilizing process like the distant health operation, for example the telehealth and the telemedicine administration to limit the transmission of the dangerous infection, so they can empower indicated patient to distantly speak with the healthcare experts through IT framework. And it helps a lot. It worked a lot in a real life. This example was embedded, and mostly the doctors were giving the patients all the advices through online, and it helped both of them to protect themselves. The doctor were not contaminated with any virus with that until they directly know that this patient is COVID-19 and they're going to help them. But this technique helped a lot of people. They don't need to go out of the place, and they know that how they can consult with the doctor. And the remote diagnosis and the treatment of patient can significantly limit, and it's quite access and the labor force restriction. And along these lines, the utilize of capacity of distance healthcare administration, which can only viably and controllable, and breaking point at the fast expansion in the worldwide COVID-19 cases. And the characteristics highlight of this progressive blockchain innovation can be different benefits to the distant medical care industry. The essential benefits, which incorporated the building of electronic healthcare records, checking the authenticity of the clients, requesting quite information, guaranteeing persistence of anonymity, and also they give them a miniature installments for the utilizing remote healthcare and administration. The traceability components helps effectively to set the province of the self-testing clinics packs for COVID-19 testing. And as a result of that, whose the test come like heterogeneously are typically obliged to follow the self-evaluation like approaches to relieve the spread of the infection. And over here, I would like to indicate that these days we have like small kids A1, which are like we can test by ourselves at our homes, and we have it like an antibody antigen testing, and it's very convenient, and we can even get from the grocery stores. This is so common now. And the blockchain innovation can also help to track the follow the people of the area with the vehicles, verify permission administration level, and to compute the standing score, and the vehicle dependent on its presentation in its trusted, responsible, straightforward way through actualizing access control convention, the personality, and the hardboard. Blockchain innovation limits the chance of like assaulted by the antigen vehicles. Moreover, this sometimes we came to know that it would very helpful for review purpose to confirm the resistance which gave the orders. So this is why we worked on it, and we find that there's some like a permanently store order to given the airborne vehicles by control room alongside the activity to purify the profound infection contaminated territories and distinguish human development and collaboration. Multitude is involved in numerous self-growing evaluated vehicles to cooperate and accomplish and share objective. Blockchain innovation can be utilized by like a multitude of the airborne vehicles to arrive at exceptionally solid worldwide choice of the safely execution of the blockchain. For example, through a blockchain-based democratic framework, evaluate vehicles for a multitude can be distinguished the most thickly populated public sports to the splash of sanitization. Now we will talk about the system design and implementation, how the execution of the stage would be decentralized application. Mostly when we talk about the blockchain, we know about the DApps. The DApps is like the decentralization of application. And also the next thing come up to the mind is P2P, like peer-to-peer networking. And the supporting of the blockchain network with the appropriate file framework, which is DFS at the backend. Ethereum was utilized to present contract structure for the medical care blockchain. This is an open source stage, and now one of the greatest public blockchain networks with the setup of the local area and an enormous assortment of the public DApps. The stage presently utilize an agreement evidence of proof of work, and calculation of it as yet design are attempting to transform into the proof of stake. This adaptability calculation in a short term, preferably for the plan of circulated application and delegate proof of stake, or a functional benzite fault tolerance agreement calculation is phase. Usually we also talk about when we talk about these kind of different elements, the consensus algorithm and the benzite algorithm is also very useful for that. The DApp will be possibly recognize the inconsistencies, unapproved information, addition and missing elements by coordinating DAFS content with the record register. Each stage is marked with an audit timeline. The fundamental components of the brilliant agreements are capacities, occasions, states, factors, and modifiers, and written in the robustness programming language. Three phases are engaged with the advancement of brilliant agreements, which use solidity programming to compose, aggregate, and report. The bytecode is made by ongoing compiler Solidity. Ethereum wallet has been utilized to unveil savvy blockchain contracts. Since all these things were going on and we started with the Ethereum and Solidity, is like yet to control under development, and the Ethereum utilizes specific the blend of the numeric constant characteristics, which known as US National Institute of Standards and Technology, NIST, and typically it's a standard way to call spec 256K1. And with the cryptography, or ECC, is a solid procedure to cryptography from a very notable RSA and development technique by using the arithmetic behind applicant bends to set up protection between the key sets is strategy utilized for the public key encryption. All through the previous few years, ECC has consistently expanded its nature because of the capability to give a similar degree of insurance as RSA with a much lower key size, the accompanying capacity to portray spec 256K1 band, which produce LLA band. Over here, we have these two equations, which is the P2 with the Q3 plus 7 over Fx or P2 mode, because the mode P, visible number of the P module, shows that there are bend arrives at the limited prime request like field likewise and composed by Fx, where x is like a 2 exponent of 56 and there is exceptionally numerous numbers. Since this bend is characteristics over limited prime request field instead of over genuine numbers of two-dimensional example of spot, making it hard to envision, making gathering up P sorry, with huge gathering and the number suggested by a hash Q and huge sufficient to cryptography representative. This is like a figure which we get through by implementing the things, the typical type of stress, which bend and extra point on the limitlessness and O at the homogeneous direction that work as gathering personalities, since the band is balanced about the x pivot. So we can take the this minus x to the country point given any point to the x. So we were believing on working on this, that minus O, like a negative O, to be a positive one, like a O, so it get the value. And in this event, the X and the Y are two focuses on the band. At that point, the like a company way to we can particularly third point X plus Y, so we can add it. Over here, we can see that the expansion of this is X plus Y plus Z, like three different nodes, is equal to 0, where two values of X and Y, adding them to the value of Z, which is a cubic band for the coverage. And here in the figure 4, the graph value for like x plus y is equal to 0. And the definition how it expansion works is here, like how the characteristics of v, x plus, and the begin with the characteristics and inverse with one another. At least in one of chance we can have the point like x is equal to y, so we can depict the distance between them. Now I will speak about the blockchain-based smart contract framework, which control the transmission of COVID-19. This is the framework where we can see that the use of the blockchain technology to curb the coronavirus disease COVID-19 transmission. And this is the system design of workflow or smart contract, where we can see the access of the provided contract, request of the access, Ethereum blockchain is working on that. And when the transaction is coming, it working with the API, with the database. And also on the Ethereum node, we having the transaction, which is called block transaction, smart contract, access control, data allocation, and identify user. Using all these things, we are just like having the innovation and the fabricated that all the condition from taking care of different consensus, like the different consents, and found it like in a figure 7, and it like showing us the plan performing various exercises. And now the standards are controlling information of authorization, like how it will work, and likewise how all the screen activities to route to the acquaintance and close by all job strategies, and how it created and explained and the coordinated with the key agreements, and how it is the mining interaction is forget about. The medical care in the blockchain can be extended to developing and handling and incorporated with the blockchain information environment, which make it simpler and difficult to reach crowds to be included. But over here, the feeling and the framework will aid the recovery, audit the executives of the complex information, and practice in the medical care area. The key goal is to share data through key blockchain decreased by empowering emergency clinics, doctors, crisis facilities, and different accomplishments to successfully access and trade the read-email data of the patient among various partners. We already found some existing application based on the blockchain, which one of them is MiPasa, is similar system as we're talking before on our system, well supported by the World Health Organization, and the software joined as Oracle or Microsoft, and considering IBM Hyperledger Fabric blockchain agreements. And this is the like ground-breaking project aims to enhance the insight available of the evaluation of the COVID-19. This will be accomplished from the information along the data medical clinics and medical services, the security protection, and the basic components. The second one is Prescripto, and other application that deals with the stockpile of medication, and the modern wave of clinic solution ensure the character of patients, securing their individuality. Undoubtedly, that how it can be useful for medical care frameworks, and very welcome against the COVID-19. in conclusion, this paper in which we examine that how arising the blockchain innovation highlights and benefit and can be utilized for battling COVID-19 pandemic. And in this paper, we investigated the potential blockchain application from fundamentally the medical services crisis viewpoint to talk about the key job that blockchain can play during the COVID-19 pandemic. We identified that the critical existence was taking a part and the framework for medical crisis administration to battle with the COVID-19. We examined the existing blockchain-based framework and grown as late of the assorted services. Our key finding and proposals included that the focal points of the blockchain innovation regarding the sufficient trust, security, detectability, and reliability can incredibly help specialists to reverse the answer to fight against the COVID-19 pandemic, and the execution of tracing context agreements incredibly relies upon the sum of the speed of the gathered data identified with the area, travel history, and COVID-19 test consequences of the people, and suggested that the how protection of the client information should be safeguarded by the contact tracing initiative. Blockchain innovations is planned to give like a helpful, responsible and cooperative climate, and the member were engaged to inventory network coordinates of vaccination, the selection of the piece, like a base of the blockchain innovation, but member of incredibly relies upon the working and the transparency and the consistency with the standard and the secure information against the abuse. And with this, I would like to say thank you, and I would like to announce